Welcome to today's deep dive. We are really glad you decided to spend some time with us today.
Yeah, thanks for joining us.
So our mission today is to explore a pretty detailed, newly released report from the World Health Organization and the International Agency for Research on Cancer.
Right, the data that just came out ahead of World Cancer Day.
Exactly, February 4th, 2026.
Mm.
And the core revelation here really challenges a lot of the preconceived notions we have about public health.
It absolutely does.
Because when you hear the word cancer, it's very easy to feel a sense of inevitability, to feel like it's just a roll of the genetic dice.
Oh, for sure. It's often viewed as this unavoidable fate.
But this new global analysis reveals that nearly 4 in 10 cancer cases globally are entirely preventable.
Okay, let's unpack this because the sheer scale of the data we are looking at it's just massive.
Staggering. But it's also, I think, a really empowering roadmap. When we look at global health data on this scale, it's very easy for the numbers to feel a bit grim or overwhelming.
Yeah, totally. But that is not the case with this report. It takes a massive portion of the global cancer burden out of the realm of the unavoidable, and it places it directly into the realm of human action.
Human action and public policy, right?
Exactly. Systemic change. It's a roadmap for what we can actually control.
Well, we are talking about an analysis spanning 185 countries. They looked at 36 different types of cancer and evaluated 30 specific preventable causes.
It's a remarkably comprehensive data set.
And when you crunch all those numbers from the year 2022, the reality becomes so clear. 37% of all new cancer cases were linked to preventable causes.
37%.
That translates to around 7.1 million individual cases in a single year that did not necessarily have to happen.
7.1 million lives. Families, communities impacted. And when we start looking closely at those 30 preventable causes, it just highlights how deeply integrated our daily environments are with our cellular health.
Yeah, our workplaces, our daily habits. I was looking through the list of causes in this report, and I definitely saw the usual suspects, right? The ones we've been warned about for decades.
Behavioral ones, mostly.
Right. There's tobacco, of course, alcohol consumption. You got high body mass index, along with physical inactivity.
And environmental factors, too.
Yeah, air pollution and ultraviolet radiation.
Yeah.
But there was a whole section in this analysis that really caught me off guard.
The infections.
The infections.
Yeah.
For the very first time in a global assessment of this kind, the researchers included 9 cancer-causing infections. They put infectious diseases right alongside things like smoking and sun exposure.
What's fascinating here is that incorporating these infectious causes alongside the behavioral and environmental risks, it represents a landmark shift in how the medical community tracks cancer.
Because it's not just a lifestyle thing anymore.
Exactly. Dr. Isabel Sirojamataram, the deputy head of the IRC Cancer Surveillance Unit, she specifically highlighted this. She noted that this comprehensive assessment provides one of our most powerful opportunities to actually reduce the global cancer burden.
Because for decades, prevention campaigns have largely focused on personal lifestyle choices, right?
What you eat, whether you exercise, whether you smoke.
But by validating that infectious agents are primary players, the toolkit for prevention expands dramatically.
We aren't just talking about behavior modification anymore. We are talking about virology and bacteriology.
That feels like a total paradigm shift. It really makes me wonder how these different causes stack up against each other globally.
There is a very clear hierarchy in the data.
Yeah, looking at it, there seems to be a top tier of preventable causes,
Definitely a clear top 3. Taking the #1 spot globally is tobacco.
which accounts for 15% of all new cancer cases, right?
Correct. 15%. Then, coming in second are those infections we just mentioned, which account for 10%. And in third place is alcohol consumption at 3%.
I want to pause on that second one for a second. 10% of all global cancers being caused by infections. That is a striking figure.
It really is.
How does that translate into the actual types of cancer people are getting?
Well, we can draw a direct line from those top 3 causes to the top 3 specific cancer types. Just 3 types of cancer account for nearly half of all preventable cases globally.
Half. Just 3 types.
Yes, for both men and women. We're looking at lung cancer, stomach cancer, and cervical cancer.
Okay, it makes total sense that lung cancer is tied primarily to smoking, given tobacco's 15% share and obviously air pollution playing a role there too.
Right.
But stomach cancer, tied to a bug. How does an infection actually turn into cancer?
It surprises a lot of people, but stomach cancer is largely attributable to an infection from the Helicobacter pylori bacteria.
H. pylori.
Exactly, it's a very common stomach bug. The way it works is that H. pylori embeds itself in the mucus lining of the stomach.
Okay.
And over years, sometimes decades, it causes chronic low-grade inflammation. That constant state of inflammation forces the cells in your stomach lining to turn over and regenerate much more rapidly than normal.
Oh, I see. And faster regeneration means more chances for a mistake.
Precisely. Every time a cell divides, there is a tiny chance of a genetic copying error. Multiply that rapid cell division over 20 or 30 years, along with the oxidative stress from the inflammation.
And eventually those cellular changes mutate into cancer.
You've got it.
That is fascinating. So it's not that the bacteria itself is the cancer.
No.
It just creates the hostile environment that allows the cancer to develop.
Exactly. And then the third one, cervical cancer, is overwhelmingly caused by the human papillomavirus, or HPV.
Again, another infection, but this time it's a virus rather than a bacteria.
Yes, and HPV works a bit differently. Certain high-risk strains of the virus can actually integrate their own viral DNA directly into the DNA of the host's cervical cells.
Wow.
This physically interferes with the cell's normal tumor suppressor functions, which just allows them to grow completely out of control.
When you lay out the biology like that, it totally reshapes what prevention means in a practical sense.
It really does.
If you're listening to this, it's vital to understand that cancer prevention isn't just a matter of willpower or just giving up bad habits. Yes, quitting smoking and moderating alcohol are crucial,
Obviously.
but prevention is also about the air quality regulations in your city. It's about childhood access to vaccines. It's about a doctor catching and treating a bacterial stomach infection with simple antibiotics before it has a chance to mutate your cells over a decade.
It shifts the burden from solely being about individual choices to being a matter of public health infrastructure.
Right, because you can't just choose to breathe clean air if you live in a heavily polluted industrial zone.
And you can't just choose not to contract a virus if you live in a region without access to a robust vaccination program.
Which brings us to a really compelling part of the report. The data gets incredibly granular when it looks at who is actually carrying the burden of these preventable cancers,
There is a very sharp demographic divide.
specifically between men and women. The data shows that 45% of new cancer cases in men are preventable. But for women, that number drops to 30%.
That's a huge difference.
Why is there a 15 percentage point gap between genders?
Well, that gap represents millions of global cases, so it's a crucial question. If we break down the male data, you can see exactly where that variance comes from. For men globally, smoking takes a dominant lead.
Just massive.
It accounts for an estimated 23% of all new cancer cases, nearly a quarter of all male cancers tied just to tobacco.
That is wild.
That is followed by infections at 9% and alcohol at 4%.
But when you flip over to the data for women globally, the order completely shifts.
It does.
For women, infections are actually the #1 preventable cause, accounting for 11% of all new cancer cases. Smoking drops way down to second place at 6%, and high BMI comes in third at 3%.
It's a completely different risk profile.
Why are men's smoking at such a higher rate, and why are women disproportionately affected by these infections?
If we connect this to the bigger picture, socioeconomic factors and historical norms are really pulling the strings behind all of these risk exposures. This gap isn't just about biology.
Right.
It's about how men and women live, work, and interact with society differently across the globe. Historically and currently in many developing nations, men have had much higher rates of smoking and alcohol consumption.
Due to cultural norms, I imagine.
Cultural norms and highly targeted marketing. Furthermore, men are statistically more likely to work in heavy industrial occupations, mining, manufacturing, construction.
Places where they're exposed to airborne carcinogens.
Exactly, things like asbestos or severe industrial air pollution.
That makes a lot of sense. And I imagine for women, the burden of infectious causes being so high, particularly HPV leading to cervical cancer, that points to systemic issues with healthcare access.
Exactly. The high rate of infection-driven cancers in women highlights severe gaps in reproductive care and vaccination rollouts in various parts of the world.
Because cervical cancer is highly preventable now.
Highly preventable. With the HPV vaccine and regular pap smears or HPV DNA testing, we can stop it early. When we see high rates of it globally, we aren't seeing a failure of individual choices.
We are seeing a failure of the healthcare system.
Yes, a failure to reach those women with basic preventative care. Gender norms, Workplace regulations, the availability of rural clinics, all of these dictate who is exposed to what risks.
And ultimately, who develops a preventable cancer?
Precisely.
That socioeconomic thread becomes even more obvious when we look at the geographic map of risk in the report.
The regional disparities are really eye-opening.
They are. For instance, for men, the highest preventable burden is in East Asia. 57% of new cancer cases for men in East Asia are preventable.
More than half.
But then you look at Latin America and the Caribbean, and for men there, it's only 28%.
Yeah.
How can geography dictate risks so sharply?
And we see substantial swings for women as well. Among women, preventable cancers range from a low of 24% in North Africa and West Asia, all the way up to 38% in sub-Saharan Africa.
So what does this all mean? If you could be a man in East Asia and your risk of a preventable cancer is double what it would be in Latin America, what is actually happening on the ground in these regions?
It comes back to the reality that this is about deeply ingrained systemic issues. Let's look at East Asia, where you have that 57% rate for men.
Right.
That region has experienced incredibly rapid industrialization over the last few decades, which often outpaces environmental regulations. So you have high levels of occupational exposure and urban air pollution.
Combined with the smoking rates.
Yes. Combined with a deeply entrenched cultural history of male smoking, which has been heavily pushed by state-owned or powerful tobacco monopolies.
It creates a perfect storm for lung and respiratory cancers.
Exactly. Now, Latin America, conversely, has implemented some of the most aggressive and successful anti-tobacco public health campaigns and taxation models over the last 20 years.
And it shows in the data.
It is directly reflected in their lower number.
That contrast is really helpful to understand.
Right.
And what about the data for women in sub-Saharan Africa? Why are preventable cancers sitting at 38% there?
In sub-Saharan Africa, the high rate for women is inextricably linked to the capacity of local health systems. The primary driver there is cervical cancer caused by HPV.
Right.
Unlike wealthier nations where the HPV vaccine is routinely given to adolescents and adult women receive regular preventative screenings, many parts of sub-Saharan Africa lack that medical infrastructure.
They might not have the cold chain storage for vaccines or the funding.
Exactly. So a highly preventable viral infection is allowed to progress into cancer entirely unchecked.
We have this incredibly robust data set now. We know what causes the cancers, whether it's tobacco, a bacteria, or a virus. We know who is getting them, split by gender and occupation.
We have the map.
We know exactly where they are happening on a global map. Where do we go from here? How does the global health community actually use this report?
Well, as Dr. Andre Ilbawi, the WHO team lead for cancer control, pointed out, this data provides the exact, specific information governments need to be proactive rather than reactive.
Proactive prevention.
Right. By understanding these highly specific, context-dependent patterns, governments can actually stop cancer cases before they start.
So if a country sees its lung cancer rates spiking in a specific industrial zone,
They don't just need to build another oncology ward, they need to implement strict emission regulations and worker safety protocols.
it sounds like the solutions have to move out of the hospital and into the halls of government.
Absolutely.
If we are looking at strategies to address this, it goes far beyond telling people to eat better. We're talking about strong, enforceable tobacco control measures and taxation.
Regulating the availability and marketing of alcohol.
We need comprehensive global rollouts of HPV and hepatitis B vaccinations to tackle those infectious causes at the root.
And urban planning policies.
Yes, policies that improve air quality, ensure safer workplaces, and create environments that naturally promote healthy food access and physical activity.
And that requires a fundamental paradigm shift in how governments operate. We call this the health in all policies approach, or the ripple effect.
Health in all policies, I like that.
Because preventing cancer is no longer just a job for the Ministry of Health. It requires coordinated action across the entire spectrum of society.
Every sector has a role.
Right. You need the education sector involved in early awareness. You need the energy and transport sectors working actively to transition away from fossil fuels to reduce air pollution.
And the labor sector strictly enforcing occupational safety, so workers aren't breathing in toxins for 8 hours a day.
It's the ultimate team effort.
And for you, as the listener, the primary takeaway here is that advocating for these systemic changes does so much more than just reduce cancer incidence.
It changes society.
Exactly. When a society addresses these preventable risk factors, it dramatically lowers long-term healthcare costs, it frees up critical medical resources for those who have unpreventable genetic diseases, and it improves the overall day-to-day well-being of the entire population.
You get cleaner air, safer jobs, and healthier cities.
A reduction in the cancer rate almost becomes a byproduct of just building a better, safer world.
Precisely. It shifts cancer prevention from being a defensive medical battle fought patient by patient to being an offensive societal project fought on the level of policy and infrastructure.
To wrap up today's deep dive, the empowering realization we want to leave you with is that nearly 40% of the global cancer burden is not some unavoidable twist of fate.
It really isn't.
It is entirely within human control to prevent. We have the data, we have the map, and we know the causes.
And I'd like to leave you with one final thought to ponder as you go about your day.
Please do.
Based on the study's landmark inclusion of infectious diseases, consider this. If major drivers of global cancer are actually infectious agents like HPV and Helicobacter pylori, how might the future of cancer prevention look less like traditional oncology and more like standard infectious disease control?
That is a great point.
Imagine a world where fighting cancer looks less like chemotherapy and radiation and more like globally coordinated vaccination drives and targeted antibiotic campaigns. It fundamentally changes what it means to cure cancer.
That is a deeply profound way to look at it. The future of cancer prevention might very well be a simple vaccine or a course of antibiotics. Thank you so much for joining us on this deep dive. We really enjoyed exploring this material with you, and we'll be waiting for you right here for the next one.